diseases were not uncommon, and as a result became an influential element surrounding a dark undertone in Shakespeare's work.
The most prominent disease of the Elizabethan period was the bubonic plague, also known as the Black Death, which was first spread in Europe through trading ports in England. This disease was transmitted through rats with infectious fleas. People with this disease grew painful swellings in areas like the neck, groin, armpits, and legs while having high fever, muscular pain, and bleeding in the lungs. The Black Death caused extreme terror and swept about 1/3 of Europe's population.
Other diseases that people feared were dysentery and typhoid. People with these diseases displayed symptoms of high fever, abdominal pain, dehydration, diarrhea, and in extreme cases, patients developed meningitis, arthritis, a hemorrhage, and even a coma.
It wasn't only physical illnesses that burdened these people. Many of them suffered from mental illnesses. Anxiety, dementia, depression, hallucinations, and hysteria were eminent conditions in which many people suffered at this time.
In order to relieve the symptoms of most of the fatal diseases, doctors used natural and herbal concoctions such as rose, lavender, sage, and vinegar. Symptoms of the bubonic plague were usually treated with the spread of butter, onion, and garlic, or even anti-plague pills that contained snake meat, saffron, and toxins inside. Physicians also believed that bloodletting and cutting a vein near the infected area was a method to treat the illnesses. Although the unsanitary conditions of this period definitely helped the spread of diseases, physicians helped to contain them by discouraging certain activities and promoting certain diets.
Some scholars believe that William Shakespeare obtained his knowledge in medicine through his son-in-law John Haw, a physician who also studied herbs, while others claim that he gathered the knowledge on his own. This was quite influential because he was definitely one who was burdened with the horrible illnesses at the time. In fact, Shakespeare was deeply afraid of the Black Death. Not only did 3 of his sisters and 1 brother die from the plague, but so did his only son Hamlet, who was only 11 years old. It is unknown whether Hamlet was inspired by his son, seeing as Shakespeare never showed emotions regarding his death. However, many of his works showcase his acknowledgement of both mental and physical illnesses around him. Shakespeare makes reference to the bubonic plague in The Tempest, Timon of Athens, and King Lear, displaying characters with this horrific situation.
Medicine plays an important role in many of Shakespeare's works. In Romeo and Juliet, they both met their death due to a coma-inducing drug and an apothecary's poison. Many of the characters used medical imagery and theories to express their understanding of humans based on their behavior and knowledge. The people during this era believed the body had 4 humors, which consisted of blood, yellow bile, black bile, and phlegm. If these 4 humors weren't balanced, they were believed to have been the cause of diseases. The methods they would use to balance these humors were bloodletting, purging, and maintaining a diet. The unbalance between these 4 humors were not physical symptoms, but changes in character that were noticed by many people. Practitioners would also use astrology to help cure patients. Different body parts were each connected to a sign of the zodiac, and this is evident in Shakespeare's work of Twelfth Night.
Shakespeare also acknowledged the mental dismay that clouded society during those times. Many characters in his plays displayed symptoms of mental illnesses. For example, King Lear, a character of a play in the same name, has been repeatedly studied for his mental condition. Throughout the play, he displays symptoms that can showcase him as having depression, dementia, and anxiety because of his mental breakdowns and minor losses of reality. In Macbeth, Lady Macbeth shows symptoms of OCD when she obsessively washes her hands to somehow get rid of guilt. Hamlet, however, has raised an important question on whether or not Hamlet is actually insane or just pretending to be. Other mental conditions, such as paranoia, insomnia, anxiety, and even sleepwalking, are topics that have been discussed in Shakespeare's works.
While some consider the Elizabethan period as the era of ideas, it was also the time of devastating human conditions and affliction. There was many diseases during this time. The most fatal was the bubonic plague, known as the Black Death, which wiped out 1/3 of Europe's population. They also feared dysentery, typhoid, and the great pox, known as syphilis. The 4 humors were often blamed for illnesses which are blood, yellow bile, black bile, and phlegm. Herbs and natural resources were used to treat illnesses, as well as bloodletting, balance of diet, and even astrology. Shakespeare lost 4 siblings and his son Hamnet to the Black Death, which could have contributed to Hamlet. Shakespeare had an immense knowledge of medicine and often incorporated it into his works, such as Romeo and Juliet and Twelfth Night. Shakespeare also depicted mental illnesses in many of his works, most notably King Lear, Macbeth, and Hamlet.
I can see clearly now, the cake is done.
Bring around the rosy pocket full of posies, ashes, ashes, we all